A diagnosis of prostate cancer can be life-changing. The decision to undergo a radical prostatectomy, while potentially life-saving, brings with it a new set of challenges. One of the most significant concerns for men facing this surgery is the impact it may have on their sexual function and intimacy. It's crucial to understand that experiencing changes in sexual function after surgery is normal. There are many changes to your health that you can expect after a radical prostatectomy. The prostate gland plays a role in sexual function, and its removal can affect erections and orgasms. This section will delve into the common challenges men may face after surgery, providing information and resources to help navigate this aspect of recovery. Remember, open communication with your partner is vital during this time. Sharing your concerns and fears can strengthen your bond and help you face these challenges as a team. This journey may require patience and understanding from both partners, but with the right information and support, intimacy can be preserved and even rediscovered. This is a new chapter, not the end of the book. The most common challenge after radical prostatectomy is erectile dysfunction, or ED. Some changes to the hardness of your erection and/or how long the erection lasts happen to most men after radical prostatectomy. This means difficulty getting or maintaining an erection firm enough for sexual intercourse. ED can occur because the nerves responsible for erections are located very close to the prostate gland. These nerves can be affected during surgery, leading to temporary or, in some cases, long-term ED. Even with perfect nerve sparing, the nerves sustain at least temporary swelling after the surgery, which can paralyze them and lead to ED. The good news is that many effective treatments for ED are available, including medications, penile injections, vacuum devices, and even surgical implants. Our penile rehab program is designed to protect the erectile tissue, the penile muscle, by helping you get an erection, lowering your chances of having permanent ED and maximizing your erectile function recovery after surgery. This intervention ensures you continue to get firm erections while your nerves recover. Beyond ED, some men might experience changes in orgasm. You should still be able to achieve an orgasm or climax, a pleasurable feeling at the peak of sexual activity, even if you cannot get an erection or if no semen comes out of your penis. About 10% of our patients will say that their orgasms were better after their surgery. 70% of patients have no change in their orgasm or climax. The remaining 20% of patients can still orgasm or climax, but either the intensity or duration of the orgasm is decreased. The sensation of orgasm may be different, and men have a dry orgasm, meaning ejaculation is absent. This is because the surgery removes the seminal vesicles and part of the vas deferens, which are involved in producing semen. During the surgery, the glands and tubing that produce and carry ejaculate semen will be removed. This means that semen will no longer come out of your penis at the time of orgasm or climax. You may still experience the release of pre-ejaculate during sexual activity before orgasm because this fluid comes from glands within the urine channel. About half of the men who have had radical prostatectomy will have urinary leakage or sexual incontinence during foreplay, which is called arousal incontinence, or during the climax, which is called climacturia, on at least one occasion after surgery. This is normal and is not dangerous to you or your partner. This usually gets better over time. We suggest using a towel on the bed and avoiding oral sex the first few times you have sexual relations after the surgery until you see if you are one of the men who will get urine leakage during sex. Improving your pelvic floor muscles and daily continence by doing the Kegel exercise and emptying your bladder before sexual activity will help reduce sexual incontinence episodes. If this is severe and very bothersome to you, there are treatment options that we can offer. Early on after surgery, about 10% of men will experience pain, usually in the penis or scrotum at the time of orgasm or climax. This is due to spasm in the pelvic floor muscles. This is not dangerous and does not mean you are doing anything wrong. This is just pelvic muscle contraction. Nothing gets hurt inside, and most of the time, it will resolve by itself during the first months after surgery. If this persists or bothers you, there is a medication that could help. Since you will no longer have semen come out of your penis, you will not be able to get your partner pregnant during sex. If you have any thoughts that you might want biological children in the future, you should store semen in a local sperm bank before your surgery. If you do not bank sperm pre-op, the only way to have children would be to remove sperm directly from the testicle. This sperm can only be used with IVF or in vitro fertilization. While these changes can be concerning, it's important to remember they don't necessarily mean the end of your sex life. With the right approach, intimacy and pleasure can still be a significant part of your life after prostate cancer. The emotional impact of prostate cancer surgery on both the patient and their partner cannot be overstated. Feelings of anxiety, fear, and even depression are common. Men may struggle with their body image and masculinity, leading to feelings of inadequacy or self-doubt. Partners may also experience a range of emotions, including fear for their loved one's health and well-being, as well as uncertainty about the future of their intimate life. Open and honest communication is paramount during this time. Creating a safe space for both partners to express their feelings without judgment is essential. Couples counseling can provide valuable support and guidance as you navigate this new terrain together. Remember, you are not alone. Many resources are available to support you and your partner emotionally, including support groups, therapists specializing in sexual health, and online forums where you can connect with others who understand what you're going through. The good news is that there are many solutions and therapies available to help you regain intimacy after prostate cancer surgery. Medications like Viagra, Cialis, and Levitra can be effective in treating erectile dysfunction. Other options include penile injections, vacuum erection devices, and in some cases, penile implants. Please check out my videos regarding penile rehab after radical prostatectomy and penile implants for more info. Your doctor can help determine the best course of treatment based on your individual needs and health status. Beyond medical interventions, lifestyle modifications can also play a role in improving sexual function. Maintaining a healthy weight, eating a balanced diet, exercising regularly, and quitting smoking can all have positive effects. Remember, intimacy is more than just sexual intercourse. Exploring other forms of intimacy, such as cuddling, massage, and simply spending quality time together, can help maintain a strong emotional connection with your partner. Don't hesitate to seek professional help. Therapists specializing in sexual health can provide guidance and support for both you and your partner, and we have the resources to help you with your recovery. Remember, there is hope, and intimacy can be rekindled after prostate cancer surgery.